I'm Susan Niedwick, and I live in Newport Beach, California. I head up our Orange County office for Cutler Investment Group. I have been a financial advisor since 1997 and a certified financial planner since 2003. I have two daughters that are 17 and 18. I have a freshman in college in Texas and a junior in high school in Irvine. On the weekends, you can usually find me watching any kind of sport that is on TV, doing indoor cycling, or enjoying the many hiking trails here we have in Orange County overlooking the Pacific Ocean. Thank you for joining me today to learn more about Medicare. There are many parts of Medicare that are confusing, which is why we're trying to make it simple with the ABCs. It's my hope after the next 20 minutes that you'll feel like you know a little bit more about Medicare. Even though we're starting with the ABCs, it's a very complex topic. So you've probably seen a lot of advertisements, especially on TV right now. It's open enrollment, and I'll explain that a little bit later. There are a multitude of commercials with senior celebrities telling you to use this plan or that plan. There's zero cost. There's freedom to choose who you would like. And it's very confusing. Is that the right plan for you? Well, hopefully after this, we'll be able to determine what the right plan for you is. What we'll cover today: the parts of Medicare, Original Medicare, Part A and B, Medicare Advantage, Part C, prescription coverage, Part D, Medigap, and enrollment periods. Before Medicare was signed into law by President Lyndon B. Johnson in 1965, there wasn't any good options for seniors to have health care. As a matter of fact, over 50% of seniors 65 and older had no insurance after they were no longer working or had been let go from their job. President Truman preceded President Lyndon B. Johnson and was a big advocate for a national health insurance plan. He and the former First Lady were given Medicare cards 1 and 2. That year, 19 million seniors enrolled. Today, it's still called Original Medicare, and over 65 million seniors are enrolled. By 2030, it is expected that 79 million seniors will be enrolled in Medicare. It's for those that are 65 and older, and there are exceptions for disability. It's a federal health insurance plan that is paid for by the taxes while you are working. It's for U.S. citizens and legal residents who have lived in the U.S. for at least 5 years prior to enrolling. It is not Medicaid, which is a program run by each state and based on income. Medicare is based on insurance. Moving on, Original Medicare, Part A and Part B. We'll start with Part A. Part A is hospital coverage. It does not cost anything. Think of this as room and board. So while you're in the hospital, it's inpatient hospital stay, covering skilled nursing up to 100 days, inpatient medications, blood transfusions, and even hospice. Part A hospital coverage does have a premium. It is free if you have worked and paid taxes for 10 years, which is 40 quarters. If you have not worked for 40 quarters, say 30 to 39 or less than 30, there will be a premium. You cannot be denied coverage. Coverage is nationwide, including qualified hospitals in the U.S. Coverage is per benefit period. You must be admitted as an inpatient, which means if you go to the ER and they are observing you, you don't qualify for Plan A. You must be an inpatient. It provides an additional 60 days over the 90 days permitted. Plan A does have a late enrollment penalty. If you delay, the penalty is an additional 10% on your monthly Part A premium for 2 times the number of years you could have had Part A, but didn't sign up. For example, if you delayed 2 years enrolling in Medicare Part A, you will pay a penalty for 4 years. Continuing on with Original Medicare to Part B. What does it cover? It covers 100% of some preventative care and only 80% of outpatient care. Think of this as your doctors and your outpatient services. So doctor's visits, lab work, preventative care, outpatient surgeries, physical therapy, home health care, durable medical equipment, dialysis, and chemotherapy. Continuing with Part B, doctor and outpatient coverage, it does have a monthly premium. That is adjusted according to your income, but according to your income 2 years prior. This is called a 2-year look back. You cannot be denied coverage for Part B. Coverage is nationwide with any provider who accepts Medicare. There is a premium penalty if you do have late enrollment or if you don't qualify for a special enrollment period. I'll define special enrollment period, but basically it's when you are leaving a job or have a separation of service. There is also a late enrollment penalty. If you delay, the penalty is an additional 10% of your monthly Part B premium per 12-month period you could have had Part B, but you didn't sign up. So for example, if you delayed 2 years, your premium would be 20% higher than the standard rate. Here are the premium tiers of Part B. Remember, there's a 2-year look back. So if in 2022 you made $103,000 or less as a single filer, or $206,000 or less as a married filing joint filer, your 2024 premium is going to be $174.70. For the tiers above this base tier, there is a surcharge that is called an IRMA. IRMA stands for Income-Related Monthly Adjustment Amount, and it's a surcharge that some Medicare beneficiaries will have to pay in addition to their standard premium. Remember, IRMA brackets are a cliff, so if you make $1 over the threshold, your payments will be higher for the next year. In 2025, the base tier is going up by $10 to $185. I also want to note that for 2 people using Medicare, there are 2 separate Part B premiums. Each person has their own premium. Medicare is not a family plan, it is an individual plan. Original Medicare, remember Parts A and Part B, does not cover everything. It does not cover all of the cost of your care. 20% is out of pocket and there is no limit. Remember, no maximum limit. It does not cover prescription drugs. You would have to add Part D. It does not cover routine dental, vision, or hearing. Does not cover eyeglasses, contacts, or hearing aids. Does not cover long-term or custodial care. It doesn't cover any excess charges from a doctor you might have visited that is not in the Medicare assignment. And it does not cover care outside of the U.S. except for certain circumstances. This is the alternative of original Medicare, called Medicare Advantage. It was signed into law under President Clinton under the Balanced Budget Act of 1997. Part C Medicare Advantage is an alternative to original Medicare, Parts A and B. Plans are offered by private insurance companies. Plan members are still in the Medicare program. Benefits are administered by the plan. Most include prescription drug coverage, and they may also include some benefits such as dental, vision, and fitness. As you can see from this chart, Part C is Part A, hospital coverage, Part B, outpatient and doctors, and Part D, drugs. Part C is all of these in one. Part C, Medicare Advantage, you must be enrolled in both Part A and Part B and live in the plan area. You cannot be denied coverage based on current financial or health status, including pre-existing conditions. You may be required to use provider and pharmacy networks that are in your area. Coverage and costs may vary by plan and may change each year. There is an annual limit out of pocket for covered services, and there may be an additional plan premium in addition to Plan B premium. You must continue to pay the Part B plan premium. As you know from working, you have a choice of plans, HMOs or PPOs. The same is for Part C. With an HMO, You may have lower premiums. You may have to get a referral from a primary care physician, and you do have to use doctors that are in your network, or else they won't be covered. With a PPO, you may have a higher premium, but you will get to choose which doctors, and you don't need a referral by first going to a primary care physician. And now we're going to move on to Part D, which is prescription drug coverage. Part D is either an add-on to original Medicare or included in Plan C, Medicare Advantage. Part D has a premium, deductible, copay, and a coverage gap. In 2025, there are some changes you might have already heard about, where the coverage gap is now going to be lowered to a maximum of $2,000 versus $8,000. It is very important that if you start a new prescription drug during the year, that you verify is covered under your current plan and one of the formulary drugs on the list. You may need to evaluate a new insurance company during open enrollment. I'll define open enrollment soon. The drugs on Part D are defined by federal standards, are part of a drug list called the formulary, and some vaccines are covered under Part D that aren't covered under Part B. There is also a late enrollment penalty with Part D. If you delay more than 63 days after the initial enrollment period, the penalty is an additional 1% of the base premium for each month you were without credible coverage. This is a lifelong premium, so it's important to get it right. If you delay by 12 months, your Part D premium will include a 12% penalty added to the base premium. The next area we'll cover is Medigap, supplemental coverage to original Medicare, Parts A and Part B. It can help you cover Part A, hospital coinsurance, Part A, skilled nursing facility coinsurance, Part B, coinsurance and copays, cost of a blood transfusion up to 3 pints, cost of 365 extra hospital days, hospice coinsurance, your Part B deductible, your Part A deductible, foreign travel, emergency care, and provider charges above Medicare's pre-approved amount. Remember, Medigap is going to help you cover that gap of the 20% you are responsible for. You should also know what Medigap does not cover. It does not cover prescription drugs, routine dental, vision, and hearing care, eyeglasses, contacts, or hearing aids, custodial care, such as help with bathing, eating, or dressing, or long-term care. Within Medigap, they have their individual plans, so the letters continue, and each letter represents various benefits. Plan G is by far the most popular. These lettered plans are universal by state. Plan F in California is the same as Plan F in Nebraska. One other thing to consider with Medigap is when you are choosing Medigap coverage, which is a supplement to original Medicare, you might want to do it at the beginning versus later if you did go with a Medicare Advantage plan and now you want to go back to original Medicare. Your Medigap premium may be very high and you may have to go through a health insurance evaluation. You might not be approved. So which should you choose, original Medicare or Medicare Advantage? Original Medicare is Parts A and B, but you have to add on Part D for drugs, and if you want help covering the extra 20% that comes out of your pocket without a maximum, then you'll need to add on Medigap or Medicare Advantage, which is known as Plan C. It includes A, B, and D, and some extras like dental and vision and fitness programs. Further evaluating whether you should go with original Medicare or Medicare Advantage, let's look at if you do add Medigap. You're going to have a higher monthly premium, but you'll have the freedom to access doctors across the U.S., and you may need to pay for some extra benefits. If you go with Medicare Advantage, you will have a lower monthly premium, you'll have a defined network, and Part D will be included. The last piece we're going to discuss today is called enrollment periods. There are several of them. You will get a letter explaining any changes in coverage if you are already enrolled in Medicare or Medicare Advantage. This is called an annual enrollment letter. During an annual enrollment period, it's important to review if any of your doctors or prescriptions will no longer be covered by who the private insurance company is you were using that year. This letter will tell you what has changed. If you had any health changes, you need to make sure your new doctors or your new specialists are in network and any prescriptions are still covered. When you are signing up for Medicare, say you're 64 and you're about to turn 65, you can sign up for Medicare 3 months before your 65th birthday up to 3 months after your 65th birthday. If you are receiving Social Security benefits by the time you are 65, you will automatically be enrolled in Part A and Part B. But if you are still working and you haven't been taking Social Security, you do have an option to either use your company plan or to move over to Medicare. You do need to consider, if you have a spouse and children, that your company will still have to cover them. If you work for a company that has 25 or less employees, you may not have the option to stay on your employee's plan. You may have to move to Medicare. If you work for a company with 25 or more employees, you should have a choice whether to move to Medicare or to stay on the company plan. Another enrollment period is called a special enrollment period, which can occur when you have left an employer. You have 8 months to sign up for Medicare after a separation. If you move to a new state, this is also a special enrollment period. You have 2 months to re-enroll in your new state under Medicare. Okay, this brings us to the last page of our presentation where we want to ask, how can Cutler help you? We've gone over many letters, A, B, C's, D's, and beyond that in Medigap, whether you use supplemental to supplement original Medicare or whether you use Medicare Advantage, which could have a lower premium. Let's start a conversation before you turn 65. We want to help you avoid any penalties and meet all the deadlines. Let us help you leverage our resources to understand your coverage options. Ask us questions. It's important we plan for future needs. How does Medicare fit in with your financial plan? What are ways to reduce the cost of Medicare? So give us a call. We're here to help. Thank you for your time today, and we hope that you did learn something about Medicare.